we're going to discuss about rheumatoid arthritis. It's a chronic, progressive, systematic autoimmune disorder causing inflammation in the joints and resulting in painful deformity and immobility in ankle, wrist and feet. The common symptoms include anemia, depression, dry eyes, muscle wasting, fever and swelling in the joints, and uncommon symptoms like pericarditis, mastocytitis, pleural effusion and pulmonary fibrosis. Approximately 1% of worldwide population affecting with rheumatoid arthritis. The incidence rate of rheumatoid arthritis is about 25% in women and 5% in men. And coming to etiology, the exact cause for rheumatoid arthritis is not known. However, some external factors some factors plays an important role in developing the risk of rheumatoid arthritis include genetic factor and environmental factor. The genes which are responsible for rheumatoid arthritis like human leukocyte antigen DR1 and DR4. And environmental factors includes having family history of rheumatoid arthritis and having viral infection or due to smoking, having obesity and gut microbes. All these factors alters the gene transcription which causes the self-protein citronation. That means, for example, type 2 collagen and vimentin, in this protein, the amino acid arginine converted into another amino acid called as citrulline. These, due to susceptible genes, our own immune system recognizes this citrulinated protein as a self-antigen. The antigen representing cell carries this self-citrulinated protein into lymphoid tissue, where the lymphoid tissue secretes antibodies like IgG and RF factor. Let me explain in detail about this. Genetic factors and environmental factors alters the gene transcription where the self protein like collagen type collagen vimentin undergoes citronation, where the amino acid present in this protein arginine converted into citrulline. Our immune system recognizes this citrulinated protein as a self-antigen. Antigen representing cell carries this citrulinated protein into lymph nodes, where CD4 cells and T helper cell get activated. This activated CD4 cells and T helper cell activates macrophages to release inflammatory mediators like interleukin 1, interleukin 6 and TNF alpha. Moreover, T helper cell stimulates the proliferation of B cell. There is excessive proliferation of B cell, where the B cell differentiated into plasma cells. These plasma cells secretes antibodies like IgG. These inflammatory mediators further releases chemokinins and activates COX-2 receptor and releases prostaglandin E2. Further, T helper cells also activates fibroblast fibroblast cells and osteoclast. Both these T helper cells activates fibroblast cells and osteoclast cells. Both all these osteoclast, fibroblast, and chemokinins like COX2 receptors, prostaglandins, all these inflammatory mediators causes erosion of cartilage and damages bone joint. The secreted antibodies and anti-CCP, that is anti-citrullinated self-proteins, and inflammatory mediators or inflammatory cells are carried to bone joints through circulation. I will show. Normal bone joint. Bone joint affected by rheumatoid arthritis. Where there is an excessive proliferation of sinusoids. Due to the activation of COX2 and inflammatory cells causes endothelial cells dilation, so that there is a excess accumulation of fluid in the joints. The excess proliferated synovial forms a thick layer or a thick. This is a brief outline of inflammatory cells present in the or accumulated in synovial fluid. Antibodies and inflammatory cells all combine to form immune complexes. The chronic inflammation enhances the angiogenesis. The angiogenesis enhances the excess accumulation of fluid and inflammatory cell in the synovial joint. These excess anti-inflammatory cells, inflammatory cells enters into the brain through circulation, where brain recognizes these cells as a pyrogens and causes fever, and also it causes rheumatoid nodules. This is the brief discussion about pathogenesis of rheumatoid arthritis. Treatment of rheumatoid arthritis and diagnosis will be discussed in further videos. Until then, bye.